This is Scott Lovridge with the CAPE Project and the North Central Regional Center for Rural Development. I'm pleased to be hosting this webinar today. Our speaker is Jessica Tess, the project social media specialist. And really the purpose of today's webinar is mainly aimed at our pilot communities, but open to others. And we're looking at some of the data that can be extracted from social media that might help us identify emerging trends in your communities and looking for some feedback from folks about what might be most useful for you as you execute your programs locally. So with that, I think I'm going to turn it over to Jessica. Welcome, Jessica.
Hi everyone, thanks for coming today. So I'm going to be presenting social media trends and resources in community behavioral health. And if you attended my webinar a couple weeks ago also about social media, this should complement that very well, and welcome back. So this presentation's gonna have two parts. The first half of it, I'm going to talk about some social media trends along behavioral health topics, as well as some interesting metrics for Google search terms that I hope you'll find really interesting. The second half, I'm going to cover a few recent social media campaigns related to behavioral health that we can use as resources or good examples for what we might want to do with CAPE in the near future. So real quick, thank you to all of our partners. They're listed here. And also, if you have questions along the way, feel free to put them in the chat box as always, and we'll leave question time for the end. If I don't catch them, Dr. Leverage will point them out to me. So to start, I wanted to give probably not a complete, but nearly a comprehensive list of some of the social media trends that have been going around the last month related to some behavioral health topics. So in April, there were especially quite a few. As you can see, the month of April this year, we had Sexual Assault Awareness and Prevention Month, we had Alcohol Awareness Month, Stress Awareness Month, National Minority Health Month. April 21st was National No Deaths from Drunk Driving. The last week of April was World Immunization Week. And now that we're getting into May, actually today is a awareness day for National Children's Mental Health. So if you're interested in that, go get on Facebook or Twitter and see what people are saying. On the 24th, coming up, we're going to have National Schizophrenia and Psychosis Awareness Day, and the entire month of May is Melanoma Awareness Month. So I'm sure there are a couple more coming up in May to add to this list, and if you're interested in those, you can go and check it out. So a little bit more about how this presentation is put together. In the social media world related to behavioral health, a lot of the conversations people have are about awareness, and you can see that from that list we just went over, as well as educating people on topics and sharing resources. So a lot of the information I've put together today comes from popular social media platforms such as Twitter, Facebook, Pinterest. And I've also got a lot of data that I want to share with you from Google Trends as well as Google Correlate. And so if you have heard of Google Trends, that's great. If you haven't, what Google Trends is a place you can go to look at the volumes of search terms people put into Google over time. And so what they do is they analyze a percentage of Google web terms to determine how many searches have been done compared to the total number of Google search terms, and they do this by the day. And then they'll normalize that number off to 100. They get rid of duplicate searches. They accommodate that so that they don't have skewed data in that manner. However, if there's too low of a volume for a certain amount of data, then that you won't find information for that term. So there has to be a certain amount of data before they'll show you some trends. So here's our first example of some of that information you can find through Google Trends. One search term I've put some metrics here together for is the term mental illness. And so if you can see this top left image, this graph I've got going, this is the total volume of search terms for mental illness in the United States. Thanks, Scott's got the arrow going for me. And so this is over a 10-year period from 2004 all the way on the left up to 2014 all the way on the right. The dates are a little small, so I've just put them in a little bigger for you to see. And so in the United States overall, you can see we've got this slight U shape going in terms of the volume of search terms from all over the US. And this makes sense that it's had attention because there's been a lot of national attention on mental illness and health because of the burden placed on the public health system and its relationship to high-risk behaviors such as alcohol, tobacco, and substance abuse. And so we'll break this down a little bit more. To the right of the graph, here I'll grab the arrow to demonstrate. Over here, a nice thing that Google Trends can do for you is also pull up some numbers about phrases that are related to the search term you're searching, and show kind of the if it's a high volume trend or if it's been on the rise. It'll give you some of that information. And so that's kind of interesting. It will also tell you based on region or state where the highest volumes are. So as you can see in the United States overall, over the past 10 years, the search term mental illness has had the highest volumes in Maine, Montana, and New Hampshire. One cool thing I wanted to do, since this talk is kind of specifically focused a lot on our CAPE communities, is I've taken a couple of maps of the US. First one showing the search volumes in January to June 2004 compared to 2014, and I've got little stars so you can see where our CAPE communities should be. Hopefully I've got them accurate. And so the darker the blue, the higher the search volume for that specific area compared to the number overall. So as you can see, over the last 10 years, there has been an increased interest in these states compared to before for the search term mental health. So let's see, we've got, the Virginias over here, we've got Louisiana down here, Kansas, New Mexico, Nevada. So it's kind of cool to look at and it's fun to mess around with. So we're going to look at a couple of these. This is just our first. So a little more specific, if we want to look at a specific mental illness topic such as depression, here's more examples of some of those metrics you can see. So again, this is for specifically the United States over a period of 10 years, 2004 all the way to 2014. I don't have it written down here, but I'll tell you verbally that according to Google Trends, over the past 10 years, the top states with the highest search volumes for the search term depression have been Pennsylvania, West Virginia, and Wyoming, in that order. And so if we look at the maps of the US we have down here, we can kind of see that. So here was West Virginia in 2004, very light compared to 10 years later, now up to 2014. It's gotten a lot darker, meaning the amount of people who have put in the search term depression has increased quite a lot. If we've got someone from West Virginia attending today, maybe they can comment on why they think that is. Similarly, we've got New Mexico over here in 2004, which has been pretty light, and so things have gotten darker. And we don't have anyone represented in our CAPE communities from this area, but another note of interest is that in this region, I guess we call this the northwestern region of the United States, in 2004 this was very light, and now that area has darkened up, and we've kind of got the opposite meanwhile in the rest of the nation. very dark in 2004, and things have been lightening up. I didn't have a way to represent it here, but what you can also do if you go to Google Trends is not just look at 2 periods of time, but you can actually look at the complete 10 years, how these have changed over 10 years. So you can see 10 different clips at least for how these search volumes have changed, almost like a little clip you can watch. So if you're interested in that, you can go look at that on Google Trends. We've got another search term here, which is bipolar. And so for the search term bipolar, we have a similar trend in that interest in the definition of interest being people who have done Google searches. We do see a lot more states that are shading darker over this 10-year period of 2004 and 2014 in the United States. The top 3 states with the highest search volumes have been West Virginia, Pennsylvania, and Kentucky. One other cool thing that you can look at, I don't know if you noticed in our last slide, that in the graph there are these letters, just a couple letters of the alphabet. And so what these represent are news headlines. So if you can see up here in the screen capture, I had checked news headlines, and so they gave me just a couple. And so if I were to hover over them in Google Trends, they would tell me the source and title of a specific news line that includes my search term. And so, for instance, I have the letter A over here, and this was from October of 2013. This represents an article that came from a website called Philly.com, and the title of this was "Smoking During Pregnancy May Be Tied to Bipolar Disorder in Adult Offspring." So that's kind of interesting. As you can see over here, over the letter D for the term bipolar, there's been a huge spike, and Google has correlated that with a certain article that came out around this time. It's a little hard to tell necessarily whether the rise in interest is necessarily due to certain publications or articles or headlines that have gone out, or if perhaps there's been a publication due to rising interest. It's a little ambiguous there. But it's definitely something interesting to look at. So for the term bipolar, if we compare 2004 to 2014 and we look at our CAPE pilot communities, for instance, in New Mexico in 2004, the amount of search terms was very light compared to now in 2014. The state has gotten a lot darker. There's been a definite increase. Same thing for the state of Louisiana, where we have our New Orleans people. The state has gotten quite a lot darker. Same thing with West Virginia. If we compare in 2004 to 2014, Vermont, same deal. Although, of course, as a nation overall, there's definitely been an increase in the interest of this term bipolar for people doing searches. If you're from any of these states, however, and you have a comment on that, feel free to put that in the chat box. Moving on to another search term, schizophrenia, also a mental illness topic. So for this search term, actually back in March of 2004, this was the highest point for people interested in this search term for Google in the United States. The top 3 states over this 10-year period were excuse me, they were West Virginia, again, Indiana, and Pennsylvania. And again, we see letters for certain headlines. They don't necessarily always correlate with spikes. However, all the way over here, you can barely see it. The letter A, we've got all the way over here in the month of March 2014. This article, for example, was from a website called mir.co.uk, and this was Amanda Bynes does not have schizophrenia according to her lawyer. Um, so, like I said, can be an interesting thing you can look up yourself, or it's also you might consider using these headlines as a way to bring attention to certain topics in your local area. If you think they're worthy of attention, you can bring some of these national headlines into your local area in order to bring some attention to them. That might be something you can consider if you think it's a worthwhile thing. Looking down at our maps of the US, especially with our Cape communities, again, the term schizophrenia has been um, rising in certain states in interest over the past 10 years in total. Again, we've got New Mexico has darkened up quite a lot since 2004. Um, Pretty consistent for most of our Cape communities in this case. And again, if you have a comment about that for your area specifically, if you are a Cape community leader, or perhaps you're not, perhaps you represent a different part of this map, and you have something to say related to this, then feel free to speak
I
up
had
in the
just a
chat
quick
box.
question for the group as well. It looks like there's real
Sure.
kind of seasonal thing going on as well with this annual up and down. Is it winter, or does anybody know what is there something seasonal that happens that causes this spike in schizophrenia, I don't think you necessarily know, Jessica, but there are experts on the line in the participant list that may have some insights. And Stefan's thinking maybe it's the school calendar. Certainly, those kinds of things are also present in this data, and that might help communities think about when to approach certain topics that they identify as priorities.
Yes, definitely. And another thing to remember is that this these numbers might certainly correlate with other data about terms like schizophrenia, but this specifically represents the interest people have in terms of they're going to Google to put in search terms with schizophrenia. Um, so that would be very interesting. I might go back to Google Trends and see if there's a way I can get more granular with these graphs to see more specifically what if there are certain patterns with the time periods. Anyone else have some ideas about this? Oh, we've got Courtney. Does Google Trend allow for searching within smaller geographic spaces, such as variation within states? Yes, they do, and I'm going to have an example coming up. But you can, if you go into Google Trends, oh, I lost my arrow. I'm not sure where it is right now.
I think it's
You know
just
where my arrow went? Oh, here we go.
back in the tray.
Yeah. So if you I'm trying to grab it, maybe you can pull it out for me, Dr. Leverage. But there we go. So if on Google Trends you look at these maps of the US, they won't have the gold stars. I put those there in my screen captures, but you can click on specific states and you can look at specific regions within the state. I will not at all promise that Google will separate into regions that you will recognize. I think they have their own system for doing that based on the volume of search terms, but you can certainly get into smaller geographic spaces. However, if the amount of search terms is not to a certain level, then Google just may not have information on that area. But it's definitely worth playing around with different terms that you're interested in. Okay, what do you think, Dr. Leverage? Shall I move on from this slide for now?
Yep.
Yep, I'll take that as a yes. Okay. So I'm sure this slide doesn't surprise anybody that the search term PTSD has been on the rise in recent years. And I think the term PTSD is one that has been used and in circulation for a very short period of time, compared to other ways that people have referred to this disorder. Um, but if we look at 2004 up till 2014, we have a pretty steady rising um, line here on our graph. And oh, here's my arrow. And I don't have it on the slide, but Google was able to tell me that certain terms related to PTSD, such as PTSD symptoms, for instance, has had an increase in searching activity by about 300% in the last 10 years. Same thing for what is PTSD. That phrase has had an increase in searching for 200 at a 250%. PTSD military has had an increase in 170% over the last 10 years. Again, I'm sure if you're involved in this area, you're not surprised at all. And our maps show this as well. In 2004, we've got very, very low search volumes compared to now in 2014. A lot of these states have gotten very dark. There's a lot of interest. And so out of all the states in the past 10 years, the top 3 with the highest search volumes overall have been New Mexico, Maine, New Hampshire, and actually Vermont is coming in at number 4, although I'm doubting if that's correct when I look at this map I've got here, although it says for overall. So if you're particularly interested in this topic, there's a lot of data here you could explore at a much deeper level. And again, if you're in a CAPE community from one of these areas and you have a comment about this, feel free to put that in the chat box. So besides Google Trends, another social media area where interest has definitely cropped up, for instance, has been Twitter and Facebook. And so I've just put 3 different accounts over here that are examples of people who have started accounts dedicated to the topic PTSD that you can get in contact with and explore. So understanding PTSD, PTSD education, and this one down here is the National Center for PTSD. They all have Twitter accounts and are very dedicated to spreading awareness and resources for this topic. And if you have access to our increasing matrix, some of these accounts are available if you'd like to look them up. So okay, Courtney had asked a question about regional areas, and so here's an example of what I was mentioning. Louisiana, thankfully, when you go into more regional searches of specific terms, I could actually recognize the state of Louisiana. It's not always the case, and so depending what area you're trying to look at, you might have to do some comparing to Google Maps to figure out exactly where you're at. But if you click on the state of Louisiana, and I just happen to use the search term depression in this case, one of the terms we looked at on a national level earlier, Google Trends will separate into what I'm assuming is just convenient areas, and of course for CAPE we're especially interested in New Orleans over here, which would be down here, and you can also even click on specific regions within a state that Google separates into, and it will give you an image that looks similar to this. If I were actually on Google Trends, I could hover over one of these areas and it would give me specific numbers that correlate to this list right here. And so New Orleans is not the area with the highest amount of volume of search terms for depression, but it's still fairly up there, and we're probably not surprised because it's an urban area. But I would just remind people once again that if a certain area doesn't have a high enough volume of data, that Google might not show you anything. So let's see. I think this is the last slide I have for any of the Google Trends information. So does anyone have any specific questions before we move on to other
Just
things
let me
about this
throw out,
specifically?
is
And
this something that
we can also.
folks who are members of our pilot communities, we're putting together these data profiles. Would information like this be useful to you in working with stakeholders in terms of identifying priorities for CAPE projects? Or should we stick to other kinds of data sets? Curious to know that.
It's a great question.
So if you're from a Cape community, maybe just put in a couple words and let us know what you're thinking. That's that's one of it's a sort of a new data source that people are maybe not familiar with, and of course there's a number of other data sources out there on community behavioral health, such as the material from the SAMHSA that SAMHSA collects, and some of the other survey-based type sources. And so we're assembling all of those.
So yeah, it seems like we've got opinions that people think it could be useful. Um, Bonnie Hinn says, beyond our surveys, it provides another source. Suzanne said that it would be helpful to start a conversation. Although, yes, I agree with Bob that it depends on
Yeah,
how detailed
and
the information is
some of
available.
them are going to be, as Jessica noted. We looked at some of these the other day, and it doesn't particularly follow what I would call traditional regions. Sometimes, I mean, the Louisiana one, as Jessica mentioned, is actually fairly faithful to the state lines, and but some of them are not. But you can still, I think, if you're from the area, you would know, you know, what areas are being talked about on the map. So,
Yeah, I would also maybe lastly mention if we were to use data like this, that it's important to make sure you're sharing extremely recent information. So some of the searches I did a month ago on these topics, the way Google represents them changes enough within even a monthly period, because it's
yeah.
constantly
So we need to
calculating
date it.
and
If we're
changing
putting it out
its
on a profile, we need to
images.
date it. The search was done
Mm-hmm.
on date XYZ, probably, to clarify that.
Yeah.
All right. Well, to me, it looks like people are pretty much in agreement
All
that
right.
this would be useful to engage people in thinking about what the priority issues might be in that community. So that's great.
Yeah, and it definitely reveals a lot visually, which I think is handy for conversation starters. Okay, cool. Pull my notes back up here real quick. Okay, so diving into some specific social media platforms and leaving Google for a while, there's a lot of really interesting resources out there in the form of Twitter and Facebook accounts. Um, so, for instance, one search term that we did not look at on Google Trends, but is definitely a rising trend, has been mental illness stigma. And I'm sure some of you are not surprised by this. So, on the left here, I've got one example of a tweet that has been passed around recently, trying to raise awareness about the fact that mental illness should not be treated as any differently from a physical disease. And over here are three different examples of accounts on social media that are dedicated to raising awareness about this topic, and trying to minimize the stigma around mental illness in this country and beyond. And specifically, from what I looked at, it seems like, especially since around 2007, there has been a jump in interest around mental health stigma and mental illness stigma. A couple of news articles I was able to pull out recently around mental illness. For instance, in May of 2013, the Houston Chronicle had an article about Obama calling for an end to mental illness stigma. And then in August of 2013, CBS News posted something about for those with mental illness stigma. For those with mental illness, stigma runs deep. So this is definitely on people's radar in the nation right now, and I'm sure a lot of our audience as well. Shifting over to some topics about substance abuse, I've just pulled out a few recent tweets that have been going on related to substance abuse. This account called Everything Addiction, which is a site that finds information about addiction topics and treatments and public policy, tweeted chronic heroin use is on the rise. And then I've got a tweet down here, USA Today Health posted about the safety concerns of codeine with small children. And again, I've got just a few examples here of different Twitter accounts that also have Facebook pages that correlate, that are dedicated to topics of addictions, substance abuse, whether they're about our attitudes towards them or research, things like that. There's lots of these resources out there that we can tap into besides some of the more traditional resources we might look at for getting information about these topics. Do you have something to say, Dr. Leverage? I heard something on the line. Okay, just making sure. So if you have any interest in how to find some of these groups, feel free to ask questions or send me an email, something like that at any time. Okay, so I want to shift over into highlighting some sample campaigns that are recently spread around on social media that have been successful. So this right here is a campaign that really utilizes visual rhetoric in the online space, and so I've broken down this infographic. It did not originally look like this. I sort of chopped it up best I could to still be visually pleasing and fit on a PowerPoint slide, but this infographic is called The Annual Cost of Addictions, and they compare some different kinds of addictions, and I should mention that when they say annual cost, they are calculating on an individual basis. So if you are a person with an addiction to alcohol, they're estimating that this costs you $630 a year, compared to if you are an individual with a heroin addiction, they're saying that they estimate this costs you around $10,000 a year. And this is in US dollars. You can see the websites that this has originated from if you'd like to go look at the original infographic. Apparently it's been going around since 2011. So possibly this information is 3 years old. And also, I should also point out, because it's a little small, that it has a note here that says these figures do not include medical and other related personal or social costs of these addictions.
This is just paying for the product, right?
So just be aware of that. Yep, that's basically just what this is. How much do you pay per year on average if you have an addiction for one of these things? But again, so same thing as the Google Trends, had a lot of really great visual metrics and information pieces. There's a lot of great infographics like this that go around social media that can be great conversation starters. If you're from an area that has rising use of heroin, I mean, it's a high cost, and so if there's one thing that gets people talking, it's certainly money.
Melanie had a comment there, $95,000 a year.
Oh,
Wow.
did we? Yeah, so maybe that infographic is possibly even slightly out of date because if it's from
Well, it could also
2011.
depend on the local market. If Vermont is doing a particularly good job of keeping it out, then it's going to cost more, right? Whereas another state, if they're not
Mm-hmm.
sort of enforcing the laws around it, then maybe it's a little bit easier to get a hold of.
Right. Looks like Melanie's still typing.
Well, let's just go on. We'll catch up to Melanie.
Okay. Yeah. Alrighty. So, another really great way to utilize infographics, especially if you are interested in doing social media campaigns, is you can use these infographics to show your success. So, this was a recent social media campaign, as you can see up at the top. This went around on February 6th of this year. This particular organization is called Time to Change, and it's one of England's most ambitious programs trying to end discrimination faced by people who experience mental health problems. So they created a campaign called Time to Talk, and their goal was to start 1 million conversations about mental illness. And so this infographic, again, I've kind of chopped it up to fit it into a PowerPoint slide, um, really breaks down how they felt they were successful. And this is something that if you're interested in doing, you can do as well. So, for instance, in even just this little part of the infographic, hopefully you can see it. I apologize if it's a little small. They were able to measure that they had almost 33,000 tweets using their hashtag. They had almost 19,000 Facebook comments and shares. There were 5,581 views on their YouTube account, and nearly 32,000 visits to their website. Um, so this campaign was obviously very successful, and this was a great way to show it to all of their users. Melanie said that we are at the end of the supply line from New York City area, and the cost of heroin costs 3 times as much as it costs in larger cities. Well, that makes sense then. Okay. So I know a lot of us are really interested in programs that address behavioral health when they deal with prevention. And so this is one example campaign from Minority Health that went around on April 16th. Um, and it was called, I guess it was, oh, Let's Talk Prevention. That was the name of their campaign. And so you were invited to join experts around the nation through National Minority Health Month, their Let's Talk Prevention Twitter relay. And a Twitter relay is where someone's picks specific times where you can have a conversation on Twitter using a certain hashtag. And so they said it is a conversation about the importance of prevention as a key health strategy and identifying key factors and tactics to promote prevention as a viable way to reduce health disparities and improve the nation's health. And so I've just got a couple screenshots here. They said they had 19 different partners, for this campaign of theirs, and so you could participate that day by using this hashtag. I've also featured this campaign because they do a really great thing, in that if you wanted to participate in their campaign, you could visit their website and educate yourself on some of the ways to participate very successfully. So they included mistakes to avoid on social media, why social media was important to their topic, how you could host a Twitter chat. They also included some different templates for different things you could use to spread awareness, and how you could make that content specific to Twitter versus Facebook. So if you're interested, you can search this campaign, and all this information is readily available. And good campaigns do this. They provide resources and templates for people who want to participate. So this campaign did that really well. Just a couple more examples. So on April 24th of this year, thousands of people across the country participated in this campaign, Text Talk Act, to again help end the silence on mental health. And so if you had a smartphone, you could text this number anytime on April 24th. So I did, I participated, and so here's a screenshot of what popped up on my phone when I texted to this number. And so you were supposed to gather a couple of friends or family or colleagues and text this number together, and you would receive messages that would ask you to do different things. Right here, the first thing they asked me to do was watch a short YouTube video about mental health. They also asked me to participate in polls, answer discussion questions, or discuss them with people I had near me in my group. So some of those questions were, why is it so hard to talk about mental health? Or how has mental health affected you or people you know? So some of these campaigns don't necessarily need to happen via Twitter or Facebook. As long as you have a smartphone and you have a texting plan, they can be done in ways like this as well. Last example, perhaps you've heard of County Health Rankings. This is a Robert Wood Johnson Foundation program that's been going around, I think, around 4 years by now. What they do is collect rankings and data on regional areas, specifically by county, on different health topics. So you can go to their website, put in your zip code, and search your area, see how your area ranks compared to the rest of the United States. They provide also an action center based on certain topics if you'd like to look at programs related to certain behavioral health issues. And actually on our Health Bench website, under our toolkit, this website is listed as a resource. Specifically through their social media accounts, what they do is you can read and share stories about your community related to your health rankings, and you can learn from other communities about how you can build a culture of health. And so they also have YouTube videos, short YouTube videos about this, but their social media accounts are very active sharing this information. So it's worth taking a look. So given some of these examples, I thought we'd end and start our discussion and question section by returning to CAPE and some of the social media things we might consider doing. So if CAPE is dedicated to identifying and sharing best practices for benchmarking community behavioral health, especially related to our 10 pilot communities, how might we wish to utilize a social media campaign? These are just some of my ideas that we might consider to gather programs for our toolkit. We might try to connect with local partners or create a presence for your local area, and as well as creating awareness about what are issues in your area. But we've got a Twitter account going, we've got a Facebook going, we've all got LinkedIn connections, we've got our that growing list of emails for our survey. We should definitely think about how we want to keep utilizing and growing our network. So any questions and comments about that?
We'll give folks
or anything from the
a few
presentation.
seconds to digest all that and maybe type a little bit. One of the things that we're doing is in parallel with all this, so we're developing these profiles, and your input on what to include in that is quite useful. So we'll definitely put in some of these, what are people looking for kinds of maps into the profiles. We're also building the toolkit, and Courtney, who's on the line, and some of the others have we've identified over 400, I believe, different interventions that could be done at the community level. So we're busily putting together some brief descriptions of those and cataloging them so that people can navigate that set of resources pretty easily. So that's also coming very soon. So it's a lot. There are a lot of things that are out there that can be done about these issues. So that's the good news, I guess. A lot to sort through. I don't know. Maybe Courtney wants to make a comment on in the chat box about that. She's typing. The rest of the group looks pretty quiet.
I should also mention, we might also consider having conversations based on that are perhaps community specific. So perhaps there is a social media strategy or campaign we'd like to do for one area that might not be appropriate for another, or it might not be at this time. So we can definitely have conversations about locally oriented things we can do through social media if it becomes apparent it would be useful.
Excellent comment. Yep. Got multiple attendees typing now, so we'll just give folks a minute to hit that enter button. Oh, okay. So, Jessica, do you want to follow up with Suzanne Lowe about that? To see how to do that. You got the
Of course.
networks with a network crawler. That sounds like a great resource.
Mm-hmm. Expect an email soon, Suzanne.
Bonnie?
So Banya wants to know.
Yeah, I think
Go ahead.
there's so many people involved with this. I think it's going to be difficult to get everybody together at once. But there might be some possibilities of doing some sharing via your regional coordinators. Maybe that would be a way to organize some of that. Connect with your regional coordinator and see if there some regional convenings can happen.
Yeah, and for instance, say some of you want to have a conversation with me about something related to social media in your area. I'll definitely be sharing with everybody the types of conversations that we're all having.
Yep, Courtney had a good comment there about making that connection.
Mm-hmm.
Excellent. Mm-hmm. So I think Suzanne is sort of continuing the conversation about Google Trends, but then do that with the media.
It's true, and definitely one great way to bring attention to some of your social media activity or to grow your social media activity can be to grab people's attention locally through different media outlets, whether it's a billboard or I don't know, the newspaper or different things you think people will see.
Okay. Well, it sounds like Jessica and Suzanne are going to get together and look at some of those options. Other people are typing. Okay. seconding the motion for some regional get-togethers. Yes, you will be organizing a meeting to share the survey results for your area. We are, I should probably update folks on the survey process. If you haven't already heard, we're well into it. I think we have pretty well closed one community. We've got um, second reminders out to most of the others, and planning a third reminder on Tuesday. And at that point, we'll do an assessment to see how we're doing response-wise. If you want to know where you are response-wise today, I can just send me a note, and I will definitely let you know how many responses you have as of today. And I'm too quiet. Okay. So I was just saying that if you're interested to know how your survey is doing, I can give you an update on the number of responses we have. We've sent out second reminders to everybody on Tuesday. A third reminder will go out on Tuesday of next week. So we should be winding them down fairly soon. Melanie wants to know if you can add some names. Yes, we can add names. Just send it to me in the same format. We might do fewer reminders on those people that we're adding, but we can certainly add some people.
And in regard to Courtney's comment about evidence-based programs, and evidence-based social media campaigns, one thing we have going on our matrix of programs is there is a social media tab, and I have started putting in different accounts that have proven to be useful as I've been doing some of my research, and so feel free to be adding to that area.
And Courtney says, obviously, please nominate programs. We have about 400, but we can always use more if you're aware of some in your area.
Thank you very much, Bonnie. Thanks for being here today.
Yeah, thanks everybody for joining us. It looks like Kelly wants to know the target date for the community meetings. We need to get a little bit further into the survey. We need to figure out when the surveys are going to close to be able to set those dates. So that's why we're couching our bets a little bit there, because we need to see how the responses are doing. But that will be coming soon.